story?
How should I start now? Well, when I first came here, you want me to start from when I may not speak as nice as you guys want me to, but I'll
No,
try my
it's
best.
okay. It's very casual.
Yeah, I just woke up one morning and started seeing blurriness. I didn't take.
Just wake up one morning
Yeah, and started seeing blurriness. So,
what happened before?
I think I was doing laxative, I think called Senapal. You understand? Because I work at a restaurant, so the chef would do this detox thing. So
Oh, like everybody doing the detox.
yeah,
It's a
so
very popular trend, right?
yeah, so
Everybody want to detox.
yeah, I joined in, and
Okay.
I realized that one morning I started feeling weak, nauseous, and then one morning I woke up and started. The place was just blurry, but I didn't think it was that serious. But after about a month, I went to the doctor because I realized
So you realize one morning you found you feel blurry,
yeah,
and then you didn't go to see doctor until 1 month.
Yeah, because I thought it was just gonna wear off. Understand?
Okay.
And then I realized I was getting blind. Yeah, so I went to the doctor, and at first they did some tests. They didn't see anything, so they referred me to a specialist.
Okay.
The specialist. When I went to the specialist, they did a series of tests, and then they.
Do you recall what kind of test?
Huh?
Do you recall what kind of test?
Yeah, they put my head in something, and there was this light, and they told me that whenever I see the light, I should press. They gave me something to press whenever I see the light, and then.
Is it like MRI or CT scan or something?
I have no idea. There was this thing that I just put my head in, my chin with the rest on it, and
okay.
There would be light inside of it, and each time I see the light, they said I should press.
I know what this. They checking your retina.
I don't know what
Yeah,
it is.
the back of the eye.
Yeah,
the optic nerve. I know what they checking.
And then the thing that they use to test your eyes to see what type of glass you'd need. So
okay. Okay, and the conclusion?
Yeah, I couldn't see anything. No letters, no nothing. You understand? So the doctor called me in the office and told me that my optic nerve is dead. And there's nothing they could do. So they didn't refer me to give me any medication or anything because I was asking for that, and she come across as if just come back in 1 month time when you were blind. You understand? So it really hurt, you understand, because I don't know if she was numb or anything like that, but she just told me it is what it is. You understand? And she went back to what she was.
If they think your optic nerve is dead, then it's officially if the nerve is damaged, they can't do anything about it. That's why they said that.
Yeah. So it was really depressing because.
So how bad it is from your own experience? What can you see? How bad your vision was before?
Honestly, I would be sitting in front of you like this, and I wouldn't know what you look like. I could see your shape, but I couldn't make out your eyes, your nose. I wouldn't know if you're smiling or anything like that. It was real bad. Even when I'm sitting on the train, there'd be. I know the people are there, but I'm not able to see anyone's face. It was real scary. So I heard about this place on Linden Boulevard, and they said it's a natural place. Like, so when I went there, they charged me like $400 and said I should come back the next day. When I went back there, they said I need to spend an additional $1,500 to complete the program. But luck was on my side. The next day, someone called me and said, look, she called me Lee and said, Lee, I'm going to send you to my doctor. Whatever you get from any doctor or wherever you go, throw it away. My doctor is the best, and that was how I came here. And the first week on the medication, believe me, I started seeing improvements.
First week.
I was so grateful. I bowed down to the doctor. I thought it offended him because he think I was praising him. I was worshiping him, but I was really grateful.
Yeah.
And
it's such a relief, right? You can see again.
And that was when I realized it was not only my eyes, my kidney, my heart.
Yeah, all those contribute to the vision.
Yeah, I was bloated and I couldn't pee.
I remember when you first time you came, you really looked puffy.
And from the day I know myself until now, I've never felt this good, believe me. My body mass is down. I'm just feeling good, no pain. I'm not 100% healed as yet, but compared to how I've always felt to now, it's a blessing, believe me. And
how good you can see now?
Well, I can see you smiling. I can see you smiling. Yeah, I'm looking through the window.
You can see my wrinkle yet, right?
No, you don't have any as yet. You have a few more years to reach there. I'm looking through the window and I can see down the block. I might not be able to focus 100%, but I'm saying compared to where I was, I couldn't see beyond 6 feet. You understand?
Yeah.
All right, where you are to me now, I couldn't see past you because I ride a bike to work and I had to stop because I couldn't make out the potholes. And I was also getting deaf. Yeah, I was getting deaf. Yeah, because
you lost your hearing as well?
Yeah, it was going because when I was in the kitchen, because I work in the kitchen, they would have to be shouting at me for me to hear. And they really working because they understand my condition. So I wasn't only going blind, I was also going deaf.
God.
It was scary. Now I could hear a pin drop.
You can hear a pin drop?
Yeah.
Before they have to shout at you?
Yeah, they come close to me and shout.
Oh my God.
I was really going deaf. So it was, and I had this severe back pain before I started this program. Now it's all gone.
The back pain is gone.
Completely, I mean like 110%. You understand? And I'm able to sleep now. I would get like an hour's nap and I would wake up and not able to go back to sleep. Now I'm sleeping like a baby. Yeah.
That's really blessing.
Yeah. My appetite is
that's troubles. That's the trouble so many people in the world. They could not sleep.
Yeah, and the thing about it, when I started this program, a lot of people say to me, why don't you go to a real doctor? And I would say to them, but look, your so-called real doctor gave up on me. And this doctor is working miracle for me, so what do you want me to do? You understand? So
as long as we see result, right?
Yeah.
Doesn't matter what doctor.
I know he's the best. It's
Thank
his
you.
gift. He's the best, honestly. And I really don't understand why most people don't really know about doctors like these. You understand? Because what I'm afraid of with the what do you call the Western doctors is the medication they put you on. Even when you're listening on TV, there's so much side effect. I'd say to myself, then it's best for me to stay in my condition if there's so much side effect. You understand?
Yeah.
When I come here, the process may not be immediate, the result, but over time, you'll be cured. And the only side effect is that you'll be just getting better and better. You understand? And it doesn't get any better than that. So, believe me, it's a miracle. It's a miracle, and word cannot explain it. Believe me. If you would just have the slightest, or walk in my shoes for just a minute when I was going through my illness, you'd understand. But for me to explain it to you,
Yeah,
you couldn't.
it
You understand?
must be scary. You can't see, you can't hear. Like what else you can do?
You understand? And the thing about it, I'm not fortunate like most people would have family. You understand? So for me to be blind, my life would be over. You understand? Because I have no one to turn to. So blindness wouldn't be an option for me. You understand? Even though if
Nobody wants.
you understand? So
we take it as granted. A vision,
yeah,
we can see, it's a must.
Yeah, it's when it reaches you, I realize how much I took it for granted. Believe me.
Yeah.
Yeah.
You have to be able to hear, to be see, to smell, to
honestly, I'm gonna be 110% honest with everyone. If I had a choice between losing my limb and going blind, I'd rather lose my limb. Honestly.
Yeah.
Because
you can still move around, right?
Yeah,
with that.
Yeah, but when you're blind, it's like as if, and especially if you have no one. You understand? So I even went as far as started doing research on what can blind people do to survive. And
luckily, you don't need to use it.
You understand? And my sight is not where it used to be as yet, but where it is now, I can survive. I can live.
Yes, you can be independent with what you have now, and you actually better than before. Your kidney is better, your heart is better.
You understand? And sometimes things happen to you, and it might look bad at the moment, but sometimes it's a blessing, because if my sight, if I wasn't losing my sight, I would know that I was having kidney failure. You understand? So
yeah, the kidney also related to your hearing.
So the thing about it, by me losing my sight, I realized I have to correct this, or I research how to get back my sight, and I was fortunate to come here. And if my sight wasn't, as I'm saying, if this didn't happen to me, I think in the next year or something I would have kidney failure, which would be worse. You understand? Because I'm saying I have a weak heart, weak kidney, because you know the country that I'm from, we are not able to afford certain type of food, so malnutrition, you're not able to get certain nutrients that the body needs.
Are you a vegetarian before?
Yeah, I eliminated meat from my diet because...
Will you purposely eliminate the meat?
No, why I did it, because there was side effects. There was something that was happening to me that I always wonder why. And my stomach couldn't process it, couldn't digest. Whenever time I eat it, it would come up. So I thought that...
you know why? Because you have a weak heart.
Yeah, and my stomach was weak as well. There was infection on my stomach as well. So I was thinking that
so you cut the meat.
Yeah, meat isn't good for me. So my body is telling me that, look, you need to get this out of your diet. Not knowing that my system is not strong enough to process it.
Yeah.
You understand?
That's the reason.
So now, all right. If I eat when I lie down, no matter how early I eat, when I lie down at night, I normally have to get up because the food keep coming up. Now, I could eat 1, 2 o'clock at night, and lie down, and I'll be good.
Don't overdo it.
No, it is strange, because I'm saying this. All my life, from I was a kid coming up, I've had this problem.
You grow up with the problem.
Yeah, and for me to have this, what is it, 360?
360?
Turnaround. You understand? It's as if my life has changed in so many ways. You understand?
Now you're eating meat too.
A lot.
A lot.
Sometimes I wonder.
And you lose weight.
Yeah.
You're eating a lot of meat. You lose weight.
Just look at me. Look, it speaks for itself.
Yeah.
You understand? Yeah, I used to be bloated.
You don't, when you're vegetarian, you bloated.
No, my face used to be like, you understand? Yeah. So, I have to warn a lot of people. I have to say this. Be careful what you're getting into.
Mm-hmm.
Yeah, it's not everything that you see on the internet. There's this saying, what's good for the goose is not always what's good for the gander.
Yes.
So,
What's the word?
What's good for the goose is not always what's good for the gander.
Right.
You understand? So, something might work for this person.
Yeah.
And not work for you. You understand? So you have to be careful and be careful of these laxatives that you guys are taking, because
they work
the thing
for somebody.
about it, I was a vegetarian and I started the laxative. I was malnourished, that's the word, right? And taking the laxative, it basically got all the nutrients out my body. So it helped contribute to my blindness.
Yes.
You understand? So be careful what you're doing, guys.
Yes.
And
yes, very good advice. Because there's so many people just blind trust the whatever the on the internet or on the news, vegetarian or eat less meat or eat less whatever.
Yeah.
The way they lose weight, it's completely wrong.
Because look, I'm eating a lot of meat. Sometimes I think that I'm eating too much. But I'm not getting any bigger. I'm losing the weight. You understand? And my body feels good. So sometimes when you find that you're putting on the weight, there are issues going on inside your body that you might not know of. And if you even go to the doctor, they might tell you that because they would tell me that my cholesterol was high.
Cholesterol.
I remember I wasn't eating meat then, and I still had high cholesterol, and I was putting on weight.
Vegetarian, and
and
you
I
have
was
high
vegetarian.
cholesterol.
Yeah, you
You
understand
have
what I
high
mean?
cholesterol.
Yeah, and now I'm eating meat, and I'm feeling good.
That's it. You're feeling good.
If you can see me, you can see for yourself. You understand? You understand?
That's good. That's good.
You can see for yourself.
Very
How I look
good.
right now speak volume for itself. So
Yeah.
just be careful. And as
I remember you said before you were 210? 210?
No, 220.
220?
No, I'm like 190 and I'm 6 feet 1 inch.
And after you eat a lot of meat?
Yeah, I'm eating the meat and I'm losing the weight. You understand? Because the thing about it, my organ, which is my kidney, and they are much better, so they are able to, and my stomach, they are able to process the food more and get out whatever out of my system. It's not staying anymore.
Yes.
So
before it's a burden to your system.
No, the thing about it, my body was full of toxin because.
But you have to do the right way.
Yeah.
You have to do it the right way.
Yeah. And remember, I'm not taking anything to lose the weight. It's just that I'm eating. I try to eat right, but sometimes you're not always able to do it as it should. But as I'm saying, you have a car and there's a problem. You go to the mechanic and he fix the problem. I mean, eliminate the problem, not just a quick fix.
Yes.
That means that problem not supposed to happen again.
Right.
So that's the thing about this doctor. Whenever time you come here, as I'm saying, the only side effect you'd get is just that you'll be getting better and better.
Yeah.
Healthier and healthier.
Yeah.
So you
it's
understand?
going to the right direction.
He fix you. You understand? If he's working on your kidney, he's not going half. And the thing about it.
And you're happier, right? Before you look gloomy.
Can't you see for yourself?
I remember before you look gloomy.
Yeah, because if you're going blind and you're feeling so much pain, how can you laugh? You understand? So
right.
Yeah, I have to give thanks. And Doc let me feel like I'm part of his family, because you want me to get. It's like he's also going through what I'm going through.
Yeah, we really want to help you to get better.
No, I can feel his energy. I can feel it, because sometimes my healing might not be going as you'd want. You can see it on his face that oh gosh, and you have a way of he's doing his pen like this. He's in a thinking box. What am I gonna do next? Because he says you can feel a connection. He's going through what you're going through. You understand? And you want you to get better. So I'm look. People normally say I'm a mean guy in terms of with my money tight. You know what? I'm a miser then. And from I know myself, it's the first I found myself willing to spend money. I look forward to coming here. Believe me.
Yeah, if advice can help me to get better, I
Yeah,
want to.
because I'm seeing the result. You understand? So sometimes I'm saying, wow, I want my date to come up to come see the doctor. You understand? You understand? And the thing about it, it's not hurting my pocket. It's affordable. Very affordable. Believe me. So
that's good. That's good.
no, I'm telling you.
Uh-huh.
Remember, I went somewhere, as I was saying, and they charged me $400 today and tell me to come back the next day. Then they want me to spend an additional $1,500. And the thing about it, when I went there, they were asking me for the doctor's report.
Uh-huh.
You understand?
Uh-huh.
When I came here, I also brought the doctor report, and when I was giving it to the doc, he said he don't need it. You understand? They know, because they have some nice word they're going to give me something to oxygenate whatever is inside of me, and he's going to put me on a raw vegan diet. Remember, I'm already malnourished, and you're going to put me on a raw vegan diet. So I'll be dead by now.
Oh, more vegan diet. Then.
Yeah, no, you remember, my body needed nutrients,
Yes.
and you're gonna worsen my condition.
Oh my God!
You understand? By putting me on a raw, I should eliminate all meat. Remember, I wasn't eating any meat then, so you're gonna put me on a raw vegan diet, and you want to know. You wanted a doctor report, so I was like, nah, something is wrong. So when I came here and when I was giving the doctor, he said he don't need it, and he did his thing, and he was so on point. I didn't tell you this. I was also losing my hair. Yeah, when I was in, like, when I go in the shower, when I look, the hair would be in the tub. I was saying, but if I'm getting bald, it would normally start at an earlier age. You understand? And it would be scratching me, even on my back right here. And the doc did his thing. And look.
Yeah, I don't see any sign of losing hair.
Yeah, no, I'm good. And I used to have these.
Oh my God, there's so many benefits.
Yeah, I used to have rashes. That's a word for it? Rash?
Rash, yeah.
Yeah, and
It's itchy, right?
yeah, itchy, and it would be spreading. And I would go to the pharmacy and buy things. And it would not go away. And remember, the first time I started, whatever the doctor gave me, it went away and no more. Believe me. No more itching.
Oh my God!
I remember this used to happen.
You're going to.
It's really a lot.
The pharmaceutical company is going to chase you down.
It's really a lot. No, really a lot of benefits.
Wow! Wow!
Honestly.
Oh my God! I want everybody in the world know this. I want everybody in the world know this. There's so many benefits about this. No, so he just now. Only fix your eye, it fix your hearing, it fix your weight, it fix your heart, fix your kidney.
Yeah.
It's all those.
It fix your skin.
It fix your skin, right?
Because once inside is okay, it automatically comes out. You understand? So you'll be glowing. You understand? You don't need anything from the pharmacy to fix up yourself. Once inside is okay, it shows on the outside.
Right.
You understand? It makes your teeth wider. Look. You see?
It is? It is?
Yeah, look at my teeth.
It's pearl. Look like a pearl.
You understand? So
That's also the benefit?
Believe me.
Oh my goodness.
It speaks for itself.
You got so much bonus.
Yeah, so... It's a lot. It's a lot.
Oh my God.
It's a lot.
You have to help me. Tell everybody in the world. Tell everybody your friends. Tell all your friends.
Yeah, I'm doing that. But the thing about it, most people, what do you call it? Tunnel vision. They just focus one way. You understand?
Yeah.
Because everybody's going that way.
They're going to see the eye doctor, the liver
Yeah,
doctor,
you understand?
the stomach doctor.
Yeah.
They all fix one thing. They're trying to fix one thing and damage the other things.
No, what I think it is, this is just my opinion, I may be wrong. I think it is set up, it's a lucrative business where I come to you for my eyes, and you have a friend who's a doctor, a heart doctor, so you give me something for the eye and it correct it for a minute, but it affect my heart, so I have to go to your friend who's a heart surgeon or whatever it is, and then you try to fix my heart, and then whatever you give me, it would cause me to have cancer, so I'd have to go to the it's an ongoing thing, you understand? So
yeah, it's
yeah, so if you even look at
interest group, that's called.
Yeah, so if you even look, there's so much side effect in the medication that they're giving you, so why run the risk? Yeah, and it's really expensive.
And also they have all this official backing up.
Yes.
The guideline and
Yeah. So
and the law and all those things. That's
so,
the
let's do the right thing.
yes.
For you. Remember, you're
For
doing
yourself,
it for you.
right?
Yeah, you're doing it for yourself.
Yeah, you are the one can take care of yourself.
Yeah, so don't be fooled. You understand? Keep a open mind.
Yes, keep an open mind.
Yeah, and I can tell you, this doc is the best.
Thank
Can't
you.
get any better.
Thank you.